Hello, I am Dr. Anjima Basudeidas. I am the pediatric consultant in Fortis Greater Noida. Today we are going to talk a little bit about the pneumonia-like symptoms or flu-like symptoms which happens during the peak winter season among the children.
Pneumonia is a respiratory infection that affects the lungs, can be a serious concern, especially when it comes to children. It is often triggered by virus, bacteria, or other microorganisms. Factors such as malnutrition, poor hygiene, and lack of access to healthcare can increase the level of risk. Identifying the symptoms of pneumonia in children is crucial for early detection and intervention. Common symptoms include cough, rapid or difficult breathing, fever, chest, and pain. Parents should also be very attentive if they feel any change in the behavior of the children. Pneumonia in children demand prompt attention and proper care. Awareness of symptoms, early diagnosis, and following the prescribed treatment play a vital role in ensuring the child's swift recovery. So in Safe India, let's discuss about pneumonia in children.
This is usually the month from October to late January, early February. We see a rise of cases in respiratory tract infection. Most of these sicknesses causes normal flu-like symptoms like fever, cough, and cold, but these are mostly viral infection like influenza. RSV is one of them. These are the types of viral infections which are usually common in children, and usually they require only symptomatic treatment, so they recover on its own most of the time, but in rare cases it can become more serious, especially those children who are vulnerable to it, like maybe children who have poor nutrition, preterm babies, or children with pre-existing lung diseases. So the common symptoms is just like the flu-like symptoms like cough, fever. Fever can be high. It doesn't mean that it is a bacterial infection. There can be even it's like some children will have just like cold symptoms like runny nose. That's it. Some children will have cough, and some children can also be associated with loose stools and vomiting. These are all flu-like symptoms which can lead to respiratory tract infection. And when I say respiratory tract infection, it means anywhere from nasal passage to the lungs. Usually, 80% of the children will recover on its own because it doesn't require any treatment. Mostly, the normal household treatment like steaming and just having warm water that can help. And they recover on their own because it's a viral infection mostly. But few babies can deteriorate further because the viral can suppress the immunity, and sometimes super added infection can come onto them, and when there is a bacterial infection it might require more treatment like antibiotics. And there are some other pneumonia which are caused by bacteria like mycoplasma pneumonia, which is common in the winter, so that may require antibiotic. And because the children are small and they are not drinking enough because of sickness, that can also lead to dehydration. So because of that, most of the time we have to hospitalize them. 80% of the time it is viral infection, and that is why the requirement for the children to go to the doctors in the early on when there is persistent cough or fever, just to rule out whether it is a bacterial or viral infection. Most of the time we cannot differentiate, but there are some parameters and there are some lab tests like a swab, how we used to do it in COVID-19 time. We can take those tests. There are a lot of tests, but the drawback of the test is that the reports, by the time the reports are available, uh, already the child is either recovered from the illness, or by the time we have already started a treatment beforehand, because assuming it to be whatever infection by looking at the clinical parameters. So normal common people may not be able to differentiate between the two. But basically there are some danger signs when they need to come, like persistent fever more than 3 to 4 days, not having food I mean, decrease oral intake, or decrease urine output, or there's any breathing difficulty. So all these things are the symptoms, danger signs, which shows that they need to look for a medical help. So fever can be there up to 5 to 7 days, but if it's a high grade fever and it is lasting more than 3 days, then it is better to seek medical assistance. And the one of the main thing, I think the common thing in children, especially those children who are toddlers, who cannot say what is the problem for them, if the child is taking less feeds or food, that means there's something serious going on. So they need to seek medical attention. And urine output, why? With that, we come to know whether the child is taking adequate oral intake. So if we just take it roughly 8 to 12 hours, if there's no urine, that means the child is behind with fluids and they need to seek medical assistance. So we basically notice the hydration level of the child, and how the activity of the child is. Because we have been seeing children, so we know there's some term we use, like it's a very vague term, but as a doctor we are able to pick up like a sick child, well-looking child, or not well-looking child. So from that also we can assess how the child is. Then of course we see the vitals, heart rate and all that will point to us whether the child is really sick and how much uh, sick the child is. Even the pattern of respiration, how it is. So if there is any difficulty in respiration, then we know that the pneumonia is there. There is infection in the lungs. All those things. If the pneumonia is not controlled well in advance, so like for example, the child is completely dehydrated and not already reached that stage where the blood pressure is also dropping, that becomes the critical. Otherwise, pneumonia per se is usually treatable. It's a easily treatable disease if they get the medical attention at the right time. The commonest test we do is like blood test. We with the blood test we can make out whether there is an infection. It usually points out whether there is a bacterial or viral. We have some hint from the normal blood counts. Then one is the chest X-ray. The X-ray changes will show that there is pneumonia or not pneumonia. On examination, we can find some findings which we can hear with a stethoscope. So it will tell us, even the respiratory pattern can tell us whether the child is having pneumonia or it is just an upper respiratory tract infection. That's how we can differentiate. The other is the nasopharyngeal swab, which is particular for a particular type of strains of infection, because there are various type of flu strains, as we know from COVID thing also, and there are lots of bacteria which can cause pneumonia, different strains. So uh, just by knowing which type of viral, it doesn't help us much, but because the treatment is almost the same. But yeah, we are sure that this is a viral infection and we know that we don't need to add any antibiotic. That's what it will help. But if it's a bacterial infection, we'll have to add an antibiotic. Yeah, sometimes we do need to be hospitalized. It can become life-threatening, especially if it is not being taken care properly from the initial part. And also depends on the child's immunity. Some of the child, their immunity might be weaker than the other children, so they can get sicker more early. Or like pre-existing lung condition, like the children who have asthma, which we call it as reactive airway disease. So they are prone to have more complications because of pneumonia, because these can aggravate the asthma, where you have this difficulty breathing, or a child with a heart disease can be life threatening. But even the normal healthy children might need to be admitted, just because sometimes they come to the hospital late, and we need to treat with the IV antibiotics in some cases if they are not improving with normal symptomatic therapy like steam inhalation and all that. So then we need to admit them. Or children who are younger than 2 years, one big problem comes is because they are not taking orally, because they are not well. So the dehydration, because of the dehydration, we have to admit them to give some IV fluid, so that their kidney functions are working properly. So yeah, there are two things mainly we admit for pneumonia. One is for fluids because of dehydration. It's not a direct thing, but it's an indirect thing because of an illness the children is not taking proper meal. During the sickness time, many times the children will not take anything at all. So in that case, we, even if they are not taking solid foods, we have to take care that they're having some sort of liquids. So if they are not taking any liquids, some children will come with vomiting. Then the role of IV fluids comes, where we have to give the, saline and all those IV fluids, so that the electrolyte balance is maintained in the body. So that is one. And during illness, there's no restriction on diet if the child is taking orally whenever they are. So there's no like there are many myths like not to have oranges or lemon juice, but they can have all that. There's no issue with that as long as they're drinking something, they are good. So even if they're not taking solid, but they need to take some sort of fluids all the time. And once they recover, of course, according to the children, whatever their diet patterns, they can go back immediately as their appetite improves. Yeah, basically, there's no restriction of any diet. There are some precautions. So, of course, I mean, we cannot prevent all the illness because nothing is 100%. One is the important thing is the injection, the vaccinations. We have vaccines for flu, which is given every year. That can help to some extent, but as we all know, it's not 100%, but it can cut down 50 to 70% of infections, viral infections. Then there are pneumonia vaccines, which are in the according to the schedules we give to children. Those are also protective. Even high risk older people also are given some vaccines, pneumonia vaccines. So that can protect to some extent. So how it helps is that it protects the child, and also because nowadays it's very common to see many type of infection in the same person. So at least it can cut down the morbidity of that child, because at least you are protected from one infection. Sometimes what happens is that viral infection and bacterial infection, both of them are combined in one person, one child. So if you are given the flu vaccine, you are at least protected from that. So that helps the outcome. Other thing is, of course, the normal precautions, like if a child is sick, to be at home and not to go to school, so that the others are prevented from getting that infection. Overcrowding can lead to pneumonia, spreading of pneumonia, like flu-like illnesses. So to avoid crowded places, and hand hygiene, of course, we've learned in COVID things. So hand hygiene helps. Wearing mask as appropriate, whoever has got a cough or cold can help. All these are the precautions that can help in pneumonia. So far as we know, as of today, we don't know what is the cause exactly, but what we have come to know is that most of the infections are actually like influenza like illnesses which are already there. I mean, like respiratory syncytial virus, it is one of the virus which is very common in children, which comes in the winter. I mean, usually their peak is in the winter time. Then there is influenza, all different types of influenza infections that has been isolated. There is one bacterial infection called mycoplasma pneumonia that has also been isolated. That is what we have come to know, and adenovirus. So all these are viruses which are already there. I mean, around in the community, and it is quite common. So far they have not, as I know, they have not isolated any new strains till date, but I think it's an ongoing thing. They will come to know. But most of them, it's just that the severity, I think, is more than normal, and they are having high grade fever. And peaking is usually, it's very common to have these infections during the winter season, and it starts from October and peaks during November, usually most of the years, and it's true for every place. So but this time in China, it is, they have peaked earlier, so that is why the concern. And also because so many children are getting hospitalized because of this, so I think there's a concern for a new outbreak, like especially if it is a new infection. Yeah, I think we already know what we need to do for the flu-like illnesses. It's like, because in China also, what they're saying, seen mostly among the school children. So because in school all the children come, and their children's immunity is lower than the older people, and they are getting exposed to new infections every time. So in we see it in a normal life also, that when children go to start school, like toddlers, that is the time they get maximum cough and cold. It's a very well known thing, because they are going out of their house for the first time and getting exposed to every sort of infection. So that's why they have more cough and cold during the earlier years, especially in the preschool time, till 5 years, 6 years of age. And then gradually the frequency of infection becomes less, because they are also building immunity. So one thought is that because of the COVID restrictions, all these kids, and we all know, I think in China there were harsher lockdown measures in place, and their lockdown was also opened later than the other countries. So I think it's just that one of the theories that, because they are coming out of their houses for the first time, and all these kids have never been exposed to the normal viral infections, and they are coming out and meeting in school. So there is a surge of those infections. That could be one of the contributory factor why they are having so many infections in one go. In children, the cough syrup is not recommended mostly. We give it through nebulization, and nebulization doesn't mean that we are giving medication every time. Sometimes we give normal saline also. That much also is good enough to take care of many of the respiratory things. So nebulization per se, it's not a harmful if you're given under medical supervision. I mean, as prescribed by the doctors. Doesn't make lungs weak, but in fact it helps the lungs to function properly during the illness. So it's not a, see, the harm comes when we are giving nebulization without a doctor's guidance. It's not that once you have given nebulizer, then you require it every time. There are some illnesses like allergic this thing, where nebulization will be required in a regular basis, but in not all the cases. So it is always advisable, if you are using nebulizer, to have a regular check with the doctors and get prescribed whether nebulization is really required or not. Any medication is harmful if it's taken in excess, but the myth of not using nebulization at all, thinking it will make lungs weak, is not true. Yeah, just to keep warm, and in India we have pollution also to add it to that with the winter, so we have to be very careful. I think just avoiding the pollution during the peak time, like in the evening times, let the children play outdoors during the 12 to 3 o'clock. That's the most clearer day of the time. And also to keep the children, if they are getting flu like symptoms, to think about others and keep them home, and not let them go to school, and wearing mask. And yeah, I mean, and anybody is sick in the house, to remain a little bit separate from the children, so that they don't contract the illness. These are the simple measures. That's it. Yeah, and the age-old thing, steam inhalation always helps. Yeah. So any cough and cold, steam inhalation is one of the things they can do at home before they seek medical assistance.